With 1.5 million people diagnosed each year, heart disease is the leading cause of death in the U.S. Risk factors include everything from smoking to a high-fat diet. Tonight, Fox 17's Erica Lathan takes you inside the Heart Center at St. Thomas Hospital to see the anatomy of a heart attack.
To you, it may just look like squiggly lines on a screen, but you're looking at a heart attack in progress.
This is a picture of the right coronary artery. This is the catheter that we use to take the picture. We inject this dye through the artery, and as you can see, the artery is obstructed at this point.
Dr. Howard Walpo specializes in opening clogged arteries through a procedure called coronary angioplasty.
We push dye into this balloon through this inflation device.
He does it with a tiny catheter attached to an expandable balloon and a coil stent. The instruments are inserted into an artery in the leg and pushed through until they reach the blockage in the heart.
You can see from the two markers, this is the front and back end of the stent where the balloon is located. We're going to make several more inflations with the balloon. We're stretching the stent up to the full size of the artery.
While the onset of a heart attack is often sudden, the buildup can take years.
The heart is fed by three main arteries, and through the years many people will develop a good bit of cholesterol that builds up in the wall of that artery. And as this cholesterol builds up, it begins to narrow the artery and begins to limit blood flow downstream.
Over time, the cholesterol buildup or plaque can break apart, creating a blockage, or blood clots can form in the narrowed artery.
And when blood clot forms in the artery, it almost acts as a cork in a water bottle. It blocks off flow, and the patient downstream is getting no blood flow. So that portion of their heart is basically getting no oxygen and no nutrients, and that is the beginning of a heart attack.
It's also when heart muscle begins to die, causing irreversible damage.
So we really feel like time is muscle. The longer that artery stays obstructed, the more heart muscle will be dead.
Treating heart attack is literally a race against the clock, which is why St. Thomas Hospital works so hard to reduce the time from door to balloon.
The artery is opened up to the full size of the artery, and the blood flow is unobstructed. So this heart attack has been completely stopped.
Erica Lathan, Fox 17 News.
Dr. Walpole says muscle damage to your heart is permanent and can eventually lead to things like congestive heart failure. Tomorrow night at 9, we'll take a look at the risk factors for heart attack and what you and even your children may be doing to set yourself up for heart disease.